Introduction to Dynamic Documentation. Dynamic documentation is an electronic tool that allows providers to create free text entries for flexible and efficient clinical documentation. Dynamic documentation pulls data from the patient chart into the notes and gives the ability to meet quality, regulatory, and billing metrics for documentation through a natural physician workflow. After opening your patient's chart, select Workflow Review from the menu. It is strongly recommended that you start in the Workflow Review as it provides a format for reviewing, ordering, and documenting actions that best fit your workflow as a physician. This format will streamline your workflow to improve efficiency and increase productivity. The Workflow Review page shows a list of standard components, but based on your specialty, there may be items you do not want to see. You can remove any component by using the drop-down menu on the right. Simply uncheck the items you wish to remove and check the items again to add back into your list. Additionally, you are able to rearrange the components by dragging and dropping each component into the order you prefer. The tabs along the top of the Workflow Review are the Admit tab, which contains necessary components at the time of admission, the Manage tab, which is designed for day-to-day care of patients, and the Discharge tab, which contains necessary components at the time of discharge. The Visits, Procedure History, Family History, and Social History components are for informational purposes and are not interactive. The Family History and Social History components are populated via ambulatory offices that use eCare. The Vital Signs and Scales and Assessment components can be viewed based on the time frame selected. The Chief Complaint component is a free text field for a narrative of the patient's reason for visit, and this information will cross notes for the entire patient visit. Click Sign to finalize, but you can edit this field after signing if needed. The Subjective History of Present Illness component is also a free text field for documenting via typing, auto text, or Dragon voice recognition software. Your documentation will automatically be saved after 5 minutes, but you can click Save if you need to step away, and when you return, you may continue charting. Review of Systems and Objective Physical Exam are free text fields for documenting via typing, auto text, or Dragon. These fields will automatically save after 5 minutes, or you can click Save if needed. This information will populate your note template when completed. In the Documents and Diagnostics components, you will see the appropriate items for your patient. You can filter the documents by selecting My Notes Only or Group by Encounter. To review a document or diagnostic report, click on the blue hyperlink to open. In the Labs component, the defaulted time frame will show only the latest resulted labs for this encounter. However, you can change the time frame to view your patient's past results. A red exclamation point in your Labs component alerts you to an abnormal lab value. If you hover over the abnormal lab value, additional information will show. The Allergies component is populated via the Admission History form. Life-threatening and severe allergies are notated in red, while mild and moderate allergies are notated in black. While working in the Medications component, you can access the Meds History, Admission MedRec, and Discharge MedRec. The symbol next to each title will show you the status of each item, and the key shows you what each symbol means. Home Medications component allows you to review your patient's home medications. You can renew, cancel, or complete the medication by clicking the appropriate button or making a selection from the drop-down menu. If you make a mistake on a medication, such as canceling when you meant to renew, it is a very simple fix. Highlight the medication that was canceled in error and select the appropriate button below, or select the appropriate option from the drop-down menu. You also have the option to reset the medication back to the original form by selecting Reset from the drop-down menu on the right. Before you search to add a new problem, you must select an option from the Add New As list. The option you select will determine where the problem is placed, in the problem section only or in both the problem and diagnosis section. This visit represents the diagnosis being addressed during the current visit. This visit and chronic represents both a diagnosis and a problem. Chronic represents an active problem. Historical represents a problem that is resolved. If you wish to show or hide the historical problems, you can click the blue link in the right-hand corner to expand or collapse all historical problems. The order profile component populates when orders are added to the patient's chart. New order entry component shows specialty folders and will allow you to add individual orders to your patient's chart. Inpatient ED acute care observation option is for inpatients only. Discharge meds as prescription option is for discharging your patient. You can add orders by using the buttons listed or by typing the order in the search bar. The Home button is the home page that is set up for your order entry. The Mine button represents your plan favorites, and the Public button represents all plans available system-wide. As you start typing in the search field, a list of options will appear for your selection. As you make your selections, the order inbox tray turns green and shows the number of orders that require signature. Click the Order Inbox tray to review the orders for signature. The Orders for Signature box opens, and in this window you can sign, save, modify, or cancel orders. You are also able to assign diagnoses to your order using the Diagnosis table. We recommend keeping the Show Diagnosis table box checked, as it is a good habit to associate diagnoses with orders. In the microbiology and pathology components, you will be able to see a list of your patient's results. To review the results, click on the blue link to open the report. The health maintenance component will populate from the ambulatory offices and will show you the list of the unsatisfied items in your patient's chart. Outstanding orders component will show orders that have not been completed and have statuses of in process, future, incomplete, on hold med student, or suspended. The immunizations component is populated from the ambulatory setting and will show all ordered and documented immunizations. Now that your review and documentation are complete, you can create your note. From the workflow review, click the Create Note button. In the Provider Documentation window, you will be required to select the note type and note template you will need. The drop-down menu on the right is defaulted to show Position Note Type List in order to provide you with the note types available based on your specific role. The list of available notes will show in the drop-down menu of the required type field on the left. After selecting your note type, you must select the note template that matches to ensure correct positioning in the document's clinical notes folder. The note title defaults to the name of the selected template unless changed manually. We suggest modifying the title of your note to identify your service, such as Consult Infectious Disease or Admission H&P Internal Medicine, to aid in locating your note in the future. Currently, dynamic documentation users are not permitted to delete notes created in error. It is imperative that correct selections are made when starting your note, because if an error is made, the result will be a phone call from the HIM department to the provider for resolution. After selecting the matching note template, click OK. Your selected note template will show displaying various information that was documented in the workflow review page. Within the note template, there are 3 functions for each field that you will become familiar with. The refresh button is used to refresh the field to update any changes to the patient's information. Only the fields that pull information from the patient's chart will have this option. The Insert Free Text button is used to insert a free text field, and the Remove button is used to remove that field completely from the note. Please note that mandatory fields will not have a Remove button, and those fields must be satisfied before you can complete your note. Auto text can be used to populate any free text field and is useful when documenting repetitive verbiage. Auto text can significantly speed up your daily workflow. To manage your auto text, click into a free text field and click on the Manage Auto Text button in the toolbar. In this window, you will see a list of all auto text available to you. System auto text will be listed with an asterisk in the System column for easy recognition. These auto text were created by IT for all providers to use as desired. To create a personal auto text, click on the New Phrase button in the upper right-hand corner. After selecting New Phrase, the abbreviation and description fields will open and allow you to enter in the desired information. Each user will be able to choose the abbreviation they prefer for their personal auto text, but please be aware that your auto text abbreviation is case sensitive. For your auto text description, please use a title that is intuitive to you so you will always remember what your shortcut is. When you are finished with your abbreviation and description, click on the Add Text button. If you are copying and pasting text from another source, paste the text in the top box, then click on the Convert RTF to HTML button when complete. If you are entering in new text via typing or Dragon voice recognition, you may enter the text in the bottom box. While entering your text, please use underscores to notate the information that will vary from patient to patient. When finished, select OK to close. After clicking OK, the auto text you just created will now show in the list of phrases. If you need to modify or delete your auto text, you can do so by choosing the appropriate button in the menu. When you have completed this auto text, click Save to add to your list of customized auto text. Only your personal auto text will show, and you are not permitted to use or modify auto text created by other users. When finished, click Close. To enter your auto text, click in the free text area under History of Present Illness and start typing the abbreviation for your auto text. As you type the different characters of your text, the system will start to recognize and display the list of auto text abbreviations. For example, double-click on the period HPI selection shown to add your auto text to the selected field. Put your cursor on the first underscore, then select F3 to seamlessly move through the text and insert patient information as needed. The cursor will turn blue for easy tracking of where you are documenting. If you are using an iPad, you can touch the field to enter in the information. After you have entered patient-specific information into the fields, your section should be complete with minimal typing. If you need to step away and complete the documentation at a later time, you can save the note by clicking the icon at the top of the screen or the button in the lower right-hand corner. Saving, rather than signing or submitting, enables you to make revisions to the note at a later time. Periodically saving your note is recommended in order to preserve your work in the event of a power outage or network failure. Please note that all saved notes are published and viewable to others once created and saved. Each time a note is saved, an electronic version is archived and can be audited. If you choose to save and close your note, you will be prompted to verify that your note type and template match and that your title is how you want this note listed in the patient's chart. When complete, select OK. If you choose to save a document, please be aware that it must be signed within 24 hours to be compliant with system policy. HIM monitors all patient documentation for proper completion and will contact providers with overdue signatures. After clicking OK, you will be directed to the list of notes for this patient. You'll see in the reading pane on the left that the note you just saved is in italicized font noting that it is in a preliminary status. To return to your note for completion, double-click on the note and the system will return you to your notes page. You can filter out the notes you do not want to see by selecting the desired option from the Display drop-down menu. This window will also give you the option to add a new note to your patient's chart by selecting the Add button from the top left corner. When an eCare note is created, please write on the paper progress note, "Review eCare note," to make others aware that a progress note was completed in eCare. Another way to move information from the workflow review to your note is by tagging. Tagging is permitted in the Documents, Diagnostics, and Lab components only. Providers can toggle between the workflow review page and their note without having to save the note currently being created. Once you open the desired document, highlight the information you would like to tag, and the button will automatically display. Select the Tag button to add your selection to your Tagged Items component, and then close out of the document by using the green door in the upper left-hand corner. After tagging the information you want in your note, the tag icon will be bold to show that there are items to be used in your note. After your tagging is complete, select Create Note at the bottom of the Workflow Review page. Select the note type and template you need, and when the note opens, you will see that the items you tagged are listed on the left-hand side of the screen. To add the tagged text to a note, drag the tagged item until you see a blue dotted text box and drop the information into the section to be populated. Once the information is dropped into that section, your tagged information will show in your note. When you tag information from another provider's note, the note title, author's name, date, and time will be included as a reference at the bottom of the new document. If you copy and paste information to your note, you will not see the reference details from the original documentation. Upon clicking Sign or Submit, a window will open for you to verify that you have selected the appropriate type and template combination. Depending on your position, you will either see a Sign or a Submit option in your pop-up window. When you select Submit, the note stays in a preliminary status, and you will be required to forward the note to the appropriate provider. If your position allows you to sign a note, then the Sign button will be highlighted for you to select, and your note will be in a finalized status. All residents and mid-level providers will be required to forward their notes to the appropriate attending physician for co-signature or review based on specific department guidelines. Click on the Forward button at the top of the note, and a pop-up window will appear with a mandatory review or sign field in yellow. In the To field, type in the provider's name that you will be forwarding this note to, but please be aware of the name you are selecting, as there are multiple physicians with similar names. When complete, click OK, and the note will route to the attending physician's message center for co-signature or review. Please review your message center at the beginning and end of your shift to check for any documents you may need to resolve. If you need to forward a note to a provider that is not affiliated with St. John, you will need to use the same steps as if you were forwarding to a St. John provider, but with one minor difference. You want a copy of this document to go to the patient's primary care doctor, Dr. Kathleen Knapp, who is not a St. John provider. In the To field, you will need to enter in HIM, department. Then in the additional comments field, type "Please forward copy to Kathleen Knapp, DO." The note will be sent to the HIM department's mailbox to forward on to the requested provider. The Modify button allows you to modify a note if it has already been signed by creating an addendum. Select the note you want and choose the Modify icon from the toolbar, or right-click and select Modify from the list of choices. The Insert Addendum free text field will display, and text must be entered in this box for the Sign Submit button to be activated. Once modification is complete, Click the Sign Submit button and continue with the appropriate protocol for finalizing documentation. The Introduction to Dynamic Documentation video is now complete. Please click on the link below the video screen on the main page to receive credit for viewing. Thank you.